Robert Simmons. This video is part of my series of people who make a difference, and I'm interviewing a number of different people who have made a big difference in my life. So our first video today is with my doctor, Dr. Bill Warnock, who's a naturopathic doctor practicing in Burlington, Vermont, in that area. And I've been a patient of Bill's for over 25 years. Definitely made a difference in my life for the better many times. I'd say now that I'm in the best health I've been in my life, and I credit a lot of that to what Bill has advised me to do and the fact that I followed his advice. So Bill, welcome to the program.
Well, thanks for inviting me, Robert.
It's good to see you, and I think people want to know why naturopathic medicine as distinct from the normal MD medicine.
We are focused on prevention, and we're looking down the road, sometimes 20 or 30 years, to preventing a heart attack, diabetes, and we're doing that with natural products first because they have much fewer side effects, and especially vitamins. We're lacking in many of those. We're going to talk about that later, I think, but also other lifestyle changes like diet and exercise. So we always start with what's natural, and if we need to, then we're going to move into prescription medications. We're certainly not going to withhold those if a person needs them. And in Vermont, where I practice, naturopathic medicine has a full scope of practice, meaning we can order any test, prescribe any medication, have the same scope of practice as any MD or osteopathic doctor. For most of my patients, I'm their primary care doctor.
Right.
And that means that I have to keep track of things like cholesterol, make referrals if a person has some symptoms that deem further insight. I do blood work on people and order images and all that sort of thing.
So you're saying that in Vermont, as a naturopath, you're allowed to do pretty much anything a medical doctor does in terms of prescribing drugs if people need them, or doing other sorts of things like that, but your focus is on natural methods first?
That's correct. I can do anything that I'm trained to do. So that's a huge scope. But yeah, our focus is still natural products, vitamins, herbs, that sort of thing.
Right. In fact, let's talk about vitamins, because I remember that right when I started with you and right up to today, you had advised me to take a number of different supplements that were pretty much, what would you say, custom choices based on how you saw where my health is at, or was at, and now is at.
Well, there's certainly custom choices, but there's also fairly generic choices that I think every person should be taking to maintain their health.
So that's exactly the question I was going to ask you, is what are those?
There's a difference between surviving and thriving.
Right.
Obviously, around the world, most people do not take vitamins. And around the world, most people suffer from various diseases that could be prevented from taking vitamins over the long term.
So you're saying a lot of the diseases people have around the world could be prevented by taking the right vitamins or supplements?
Prevented, or at least lessened in the number of people that have those diseases, or the extent to which those diseases affect a person. So there are a few vitamins I believe everybody should be taking for good health, and it's not a long list. And we'll go over these in more detail later on, but they are, first of all, and probably in the order of importance, vitamin D, vitamin C, fish oil, iodine, and magnesium.
Okay, got you. And are there any others?
For this purpose, we're just going to focus on those 5.
Okay.
And there'll be other videos where I can get into more detail into specific combinations.
Well, I want to do that because that's just my personal experience, is that the things that you've suggested to me have really worked. But I do agree that people that are watching this in general are going to want to know, if there's a few things that everybody should take, what are they and why should I take them?
Okay, we will get into that, and this is going to be lots of fun.
Good. All right, carry on.